Hello, everyone. I'm Dr. Bijay Patni from Calcutta, India. I'm very thankful to Dr. Nozi Yusuf for inviting me to give this talk at the 8th Annual International Conference of Egyptian Cardiodiabetic Association. I'm privileged to talk on a very important topic, artificial sweeteners in girls and women with diabetes. These are my credentials. I'll go full screen. These are my credentials, and this is the agenda of my talk, where I'll be discussing about diabetes and artificial sweeteners used in women prevalence and trends, the sweetener types, the biological mechanism, metabolic and reproductive health risks associated with the sweeteners, regulatory marketing and public health aspects, clinical recommendation and research needs, and then after I will conclude. So we all are aware of the fact that diabetes prevalence in women is increasing worldwide, and so is the use of artificial sweeteners in diet products. We need to explore these impact on the health as far as artificial sweeteners are concerned. Women are more likely to choose the diet beverages during pregnancy, viewing them as a healthy option, and that could be detrimental. Further research need to be done in this aspect. Let's look into how to classify sweeteners. They can be classified as nutritive and non-nutritive sweeteners. The nutritive sweeteners, they provide calories used in traditional food processing, while as natural non-nutritive can be further classified into natural and artificial. Natural sweeteners are basically from the plant sources like stevia, whereas artificial non-nutritive synthetically produced with no calories like aspartame, sucralose, saccharin, etc. Further going into the classification sweeteners, one thing is for sure that FDA has approved lots of sweeteners, but they do vary in chemical structure and potency. Even those with calories provide negligible amount because of high potency, which you can very well see in this particular table. Now, this is a new kid on the block, that's allulose. Allulose is thought to be alternative to sugar because it almost tastes similar to sugar, 70% as sweet, and 70% of them is absorbed in blood and passed out in urine. They are very low calories, and at just about zero point 0.2 to zero point 0.4 calories per gram, it packs only one-tenth of the calorie of the sugar. Why it is thought to be friendly? Because it is low glycemic index, it improves insulin sensitivity, and reduces the post-meal sugar spikes. It also helps in fat burning, reduces the body fat, and enhances the feeling of fullness, thereby boosts the metabolism. Those who are proponent of this molecule allulose suggest that they may provide potential health benefits, including sugar management, weight management, and also support for dental and liver health, which could be an issue with certain artificial sweeteners. But then we need further research in order to understand its effect on overall health of an individual. Now, this allulose is generally considered safe by the FDA, but Europe additional safety evaluation need to be done before they are included in the food market. Now, let's understand the mechanism of sweetness. Artificial sweeteners bind to the sweet taste receptors with high affinity, but these taste receptors are not only present on the tongue but also in other parts like the gut epithelium, pancreatic beta cells, and hypothalamic regions. These, because of their presence in other areas, the receptor activation triggers the complex signaling cascades affecting both the insulin secretion as well as glucose metabolism. If you look at this consumption trends, what is showing that consistently the women are using or consuming more of artificial sweeteners than men, and the marketing of the diet products heavily targets this fairer sex. Consumption of non-nutritive sweetener containing beverages have increased globally about 36%. What could be the rationale for use? Why there is an increasing trend? They are thought to be reducing overall calorie intake as well as have a good impact on the glycemia. But what is more important to understanding of the long-term effect of artificial sweetness, which we have not been thought about. So lots of research needed in order to understand the implication of artificial sweetness in overall health of an individual. What could be the health concerns? There are most of the studies which are done are on the rodent models or the animal models, and what they show is really of importance because there are a lot of health issues associated with artificial sweeteners. They're linked to a lot of metabolic dysfunctions. They do alter the gut microbiota and thereby disrupt the bacterial balance in digestive tract. The paradoxical impact on glucose tolerance is seen. They increases the systemic inflammation milieu in the body. Along with that, they do impact reward pathways and appetite regulation, thereby having the neural effect also. So, in spite of being considered safe, we are should be concerned about various health concerns related to artificial sweetness. Further, when it was studied as far as aspartame is concerned, there was definite reproductive toxicity seen in animal models. The documented effects and their mechanism could be underlined that there is disrupted estrous cycles because of oxidative stress induction. There could be impaired follicle development because of hormone signaling disruption. There could be reduced anti-Mullerian hormone levels. These could be due to direct cellular toxicity. And then mitochondrial dysfunction in ovaries also seen. That's because of altered gene expression in reproductive tissue. So overall, what was seen that it suppresses the ovarian function through the mechanism of oxidative stress, increased oxidative stress. Now, further looking into what Nayak et al. In 2023 showed that aspartame can disrupt the hormone balance. It has significant decrease in the FSH, LH, estrogen, and progesterone production was seen. There could be impaired mitochondrial biogenesis and function in ovarian cells. Thereby, there could be dysfunction in follicular supporting cells, which are critical for oocyte development. And ultimately, there could be follicular reserve depletion. So, what can be said that they do reduce the ovarian follicle reserve and steroidogenesis. Now, if you look at what these high dose of artificial sweetness can do, again, these are animal studies, there can be over 40% of fertility reduction. And there can be increased number of degenerative follicles, almost 3.2 times more decrease in the number of follicles. So in those animals who were exposed. So high dose artificial sweetness exposure reduce the fertility indices and follicle viability. Very well studied in animals, and this was quoted by in the IJMS 2022. Now look at the infertility evidence. Now, for infertility in women under 35 who are consuming artificial sweetener regularly, the odd ratio is 1.79. And there is a high chance of 26% longer time to conception in patients who are consuming multiple daily servings. So, to be very clear about it, that frequent artificial use in a higher quantity as well as in regularity is associated with decreased embryo quality and also adverse pregnancy outcomes. Now, if you look at the pregnancy outcomes, what it says, consumption of these artificial sweeteners during pregnancy is associated about 18% increase of preterm birth, along with 12% low birth weight, independent of maternal BMI, and 15% high likelihood of neonatal intensive care unit stays. So basically, it has a huge impact. So a person during pregnancy should ideally be avoiding this artificial sweetness, though research in human trials are still awaited. If you look at the human studies, they are controversial because there are certain studies which do not outline the fact that they can be the outcome could be very clear cut. So more randomized trials are needed to determine the artificial sweetener safety in pregnancy because observational studies have shown the adverse outcome, but still study design do not collaborate with the clinically established causality. If you look at the food frequency questionnaires, they can be subjected to recall bias and measurement error. And most studies fail to stratify data adequately by sex. So female specific effects have not been studied very well. If you look at the animal studies, which probably are much better because they have their strengths, and I will just go into the strengths, they are controlled exposure conditions. There can be precise dosing protocol which can be followed. The direct tissue examinations can be done. Multi-generational effect can be observed. So key finding when this was done and which was reported by Naik et al., they showed both mitochondrial as well as hormonal disruption when the use of artificial sweeteners was high. So there was a dose-dependent histological damages to ovaries. The uterine tissue abnormalities was seen. Transgenerational effect on offspring was also seen, and reduced fertility indices were noted. So let's look at the gut microbiota, which we talked about, could be one of the health concerns. Disruptions can happen with the use of artificial sweeteners, thereby impacting both the metabolic and the reproductive issues. And there could be altered microbiome, gut microbiome, thereby decrease due to decreased microbial diversity and beneficial species. Along with there is increased gut permeability, thereby increasing the inflammatory markers. There is impaired glucose tolerance and insulin sensitivity, and altered products of metabolites affecting reproduction we've seen because of hormonal disruptions. So these are the various disruptions which we've seen with the use of artificial sweeteners. Study was reported in IGMS 2022. Now, looking at the placental transport, what does the study shows? This was reported by Reynolds in 2024. Then non-nutritive sweeteners can reach the fetus and the neonates, suggesting early life exposure to these neonates or the fetus. So they can cross the placental barrier because they have been detected in fetal circulation, and cord blood analysis has also confirmed the fetal exposure. Trace amounts have also been seen in the breast milk postpartum. So basically, what we understand is these artificial sweeteners do cross the placental barrier, can appear in the breast milk as well. So early like exposure is very common. Looking at the hormonal disruption, this was a study by aspartame. What they really showed that duration-dependent decline in key reproductive hormones, be it FSH, LH, estrogen, progesterone, was seen. So the more the exposure to the artificial sweeteners, there was more decline in the key reproductive hormones. Now let's come to the basic issue. That is the central mechanism, that is the oxidative stress. Now, oxidative stress happens to be the central mechanism which links the artificial sweeteners to the ovarian dysfunction. There is an elevated malonodialdehyde, which increases in ovarian tissue, which can indicate oxidative damage to DNA structure. And there can be suppressed activity of protective enzyme like SOD2 and catalase. Now let's look what is the paradox. Now what we see with the use of artificial sweeteners, they paradoxically worsens the insulin sensitivity, which was done in this particular study by Keynes Reynolds, and it was published in 2024, that home IR increased by about 30% in artificial sweetener exposed rats. Both fasting glucose and insulin were elevated, may contribute to gestational diabetes risk, as well as the paradoxical effect contradicts the intended use of bringing down the glycemia. So obviously, when the insulin resistance increases, the chances of getting better glycemic control will be affected. Now, looking into the metabolic dysfunction, what we know that the use can fundamentally alter the lipid metabolism to the extent that there can be a 37% increase in triglycerides. There could be 42% increase in AST level and 29% fat deposition. So liver enzymes definitely rose while being exposed when the rose significantly after the chronic artificial sweeteners exposure. So, what do the regulatory bodies say? What do they give? What are the guidelines? Now, WHO position 2023 has clearly advised not to go for these non-nutritive sweeteners for weight control. Contraindicated, they have clearly said not to be used because there are evidences, though not very prominent, but there are evidence of metabolic effect. Even certain studies have shown that it can increase cancer. Now, what does FDA and EFSA guidelines shows? That there should be the average daily intake or the dosage has to be very, very specific. And there should be they could not clarify as far as sex specific or pregnancy specific limits or the dosage. So this is very important that we need to have specific ADI values, and this should be the future way or future direction. That if you have a general or consensus on sex specific ADI values, then obviously we can very well tell the patients, female patients, and their use during early age, in during their the adolescence or during pregnancy, the amount which they can take, which will have not much of an impact on the overall health and the reproductive health. Now let's look into the cultural and social aspect. What are these companies doing? Basically, these companies are basically targeting those weight conscious women. Now, this is the way of marketing strategies which have been employed. So they do create the perception that artificial sweetener is necessary for weight management, and that is why the people in use of artificial sweeteners is quite high in the females or the fairer sex. And then there is the adolescent trends as well, which shows alarming rise in diet soda consumption among teenage girls, which might have established lifelong consumption pattern during critical development stages. Social media influence is also the reason why there is a lot of confusion about its safety, and people are still driven by these marketing strategies, and high consumption are seen particularly in the fairer sex. So, what are the public health implications of the use of artificial sweeteners, particularly in the female folk? Now, reproductive health could be of major importance. There could be increased risk of preterm births, may contribute a higher risk of infertility rates. So obviously, all these will require costly intervention, thereby having a healthcare burden to the society, to an individual, and to the state. So extremely important, because there could be also associated metabolic disorders, and that can again impact the metabolic aspect of an individual. There could be increased insulin resistance or liver dysfunction, and thereby increase in metabolic associated disorders. Now, consumer information is extremely important. So current labeling, though are inadequate, has to be addressed by the state, and patients needs education about cumulative exposure from multiple sources. So early life exposure may program future metabolic disease have been very well spoken about, and this was there in Proceedings Nutrition Society 2024. So to summarize my talk, I would say artificial sweeteners, regular consumption can have a huge impact on health. Regular consumption alters the taste preference and metabolic signaling pathways. They can alter the gut microbiota, thereby actually giving an environment which can be quite inflammatory and can lead to increased metabolic risk. So inflammation, though being very key, the key issues, there could be a systemic low-grade inflammation, which can definitely disrupt the hormonal balance and can lead to reproductive impact, leading to increased infertility and other complications of pregnancy. So multiple interconnected pathways mediate the artificial sweetness effect. So we have to really go into research to understand it. So what are the recommendation? First one, you have to limit your intake. There has to be a proper way of counseling the patient to limit the artificial sweetness use during the teenage age as well as during pregnancy, especially critical during pregnancy and also for women with PCOS or metabolic conditions. Always recommend some dietary alternatives. Recommend the whole food with natural sweetness instead of these artificial additives. Then support longitudinal human randomized control trials. Focus on women's specific outcomes and intergenerational effect. So what is more important now is we all need to undertake research, sex specific research so that we can have sex specific outcomes. So, the advice would be prudent moderation remains the best interim advice till we get a proper outcome from various randomized controlled trial. So, conclusion, current evidence warrants cautions regarding artificial sweetness consumption, particularly for women. Metabolic and the reproductive risk appears more significant for those with diabetes. Further research must address the sex specific differences in metabolism. Longer term human trials focusing on women health outcomes are essential. So, friends, artificial sweeteners are not a free pass. Metabolic and reproductive vigilance is warranted. Thank you.